Hello friends, welcome to the microbiology classroom. I will be today discussing a new bacteria that is Pseudomonas. So Pseudomonas, let us write. Pseudomonas is basically Pseudomonas aeruginosa, I should write, okay? Pseudomonas aeruginosa. So Pseudomonas is basically having, it's if you write like this, it is a gram-negative bacilli. Gram-negative rod, okay? It's a gram-negative rod, number one. Number two, it's cat positive, ox positive. Cat positive, ox. Ox means we are saying oxidase, okay? Cat positive, oxidase positive. And it has some virulence factors, okay? It has some virulence factors. And the pathogenesis of this bacteria will depend on those virulence factors. Another thing to remember about this oxidase positive is that these Pseudomonas are having a polar flagella. Okay, they are having polar flagella. They are having polar flagella. Okay, and they have some pigments. They have some pigments. The pigments are pyocyanin. First, I should write fluorescein. Okay, fluorescein. What is fluorescein? Fluorescein is a fluorescent pigment. Fluorescent pigment. It's a fluorescent pigment. Okay, it's a fluorescent pigment. And another pigment it has is pyocyanin. Important pigment. Question asked on this. Pyocyanin. What is this pyocyanin? Pyocyanin is a blue-green pigment. Now this will get lost, that color. Okay. So it is a blue-green pigment. Blue-green pigment. Blue-green pigment. Okay. Blue-green pigment. Why it's not getting this? Okay. Let me write like this. It's a pyocyanin is a blue-green pigment. You have to remember it's blue-green. Why sir blue-green? Because this blue-green pigment will lead to formation of blue pus. To be more precise, we say blue-green pus. Blue-green pus is characteristic. Listen to my word. Blue-green pus is characteristic, a classical sign of Pseudomonas aeruginosa cellulitis. Mostly, this is also a blue-green pus, but it is a classical sign in patients who have got burn. What? A patient got burns. He got burns. And then he got cellulitis. Infection superficial, he spread that spreading infection of that skin. Okay, and there we saw that blue green pus. That will be the most likelihood the organism will be Pseudomonas aeruginosa. Pseudomonas aeruginosa. Let me write aeruginosa for you here. Aeruginosa. Pseudomonas aeruginosa. Pseudomonas aeruginosa. Okay. So this Pseudomonas aeruginosa will cause blue pus. Blue pus. Okay. This pigment, these are the significance of this pigment. Significance of this pigment. They also, they may be writing also there are pigments like red pigments are there. Blue pigments are there. Okay. Let me write those also. Pyocyanin, pyorubicin, biomelanin. Okay. Pyoverdin. Okay. General, out of general, general pigments, if you say what about sir general or about the Pseudomonas, you would say they can have pigments such as pyocyanin. If you say general pigments, pyocyanin, pyorubin, pyomelanin, pyoverdin. This wording we are using for green. Okay, biomelanin will be for, you have a melanin pigment, so you will be having what? Blackish brown skin. You know, you have that. Pyorubin, rubin is for ruby. Ruby stands for red. Saya stands for blue. So these are the pigments they can have. But which one is mostly associated, mostly found in Pseudomonas aeruginosa? Blue-green pigment. Okay, Pyocyanin. Pyocyanin. Okay, easy. Life became easy, sir. Life became easy. Then now, what virulence factors they have? What virulence factors they have that can cause diseases? See, to first understand which diseases they cause. Okay, Pseudomonas, the best what I learned in my long time back, how I learned it is which diseases can it cause. So the name itself speaks everything. So we remember the name itself. We remember the name itself. You will say, sir, how? Once you have to remember which diseases are associated, which conditions, medical conditions are associated with Pseudomonas. What we do is we first like directly make like this. We make like this. We do Pseudomonas, right? Pseudomonas like this, right? Pseudomonas like this, guys. Make life easy. Don't start making complex life. Pseudomonas. P stands for they cause pneumonia. First, let me write short. Pneumonia. S stands for sepsis. E stands for Erythema Gangrenosum. Erythema Gangrenosum. Erythema Gangrenosum. U stands for urinary tract infections. Urinary tract infections. D stands for diabetes. Associations. Don't say it will cause diabetes. Yeah? Associations. Okay. Diabetes. Osteomyelitis. O for osteomyelitis. Osteomyelitis. O is for O square. We have O square. It causes otitis media. Otitis media is middle ear infection. Middle ear infection is called middle ear infection. Okay. And for nosocomial infection, what do you mean by nosocomial? First, let me write about M. M for mucoid polysaccharide capsule. They have a mucoid polysaccharide capsule that I will be telling you how it's associated with the disease. It attaches. So mucoid polysaccharide capsule. It has mucoid polysaccharide capsule. O stands for same, you can take it as otitis externa. Okay. Sorry, I have written otitis media. I'm really sorry. I think I am sleeping. Okay, otitis externa. Sorry, external air infection, not middle air, how it can cause. So otitis externa. Okay, osteomyelitis. Okay, guys, correct this one. Okay, you can use this for O also. Okay, one and the same thing. N stands for nosocomial infection. Nosocomial infection means in the hospital when you are doing some catheterization or equipments, catheterization, catheters, any surgical equipments. Okay. A stands for addiction. Drug addicts, they will be, okay, so addiction. S stands for skin infection. What skin infections from dermatology? What skin infections? Number one, hot tub folliculitis. Hot tub folliculitis. Hair follicle infection. Okay. Burn patients, that I told you in the beginning. So wound infection in burn patients. that's spreading cellulitis. Okay, so wound infection in burn patients. Okay, burn patients. Guys, are we clear with this? So we have pneumonia. Remember these things about Pseudomonas: sepsis, Erythema Gangrenosum, UTI, diabetes, osteomyelitis, otitis externa, mucoid polysaccharide capsule, nosocomial infection, addiction, and skin infections that can be hot tub folliculitis, wound infection in burn patients. Okay. What is the mucoid polysaccharide? This is the capsule which will help in the disease of, it causes chronic pneumonia. We said in the beginning it causes chronic pneumonia. So make an arrow like this. It causes this chronic pneumonia. Okay. Now how to remember its pathoviral factors? That also I have a mnemonic for you. Okay. This was about disease associations. No, this is mostly found in Pseudomonas aeruginosa. We are reading about Pseudomonas aeruginosa. We are reading preferably about Pseudomonas aeruginosa. Okay. You are asking this question? No, it's we are talking. I told you in the I have told you here. See, this is seen mostly in the Pseudomonas aeruginosa. Well, others can have this: pyocyanin, pyrubicin, pyromelanin. Okay. Okay. This is done. Now let me help you remember this. What virulence factors it has, by which it is spreading the disease. So we remember it by PEEP. So virulence factors. Virulence factors. Number one, PEEP. Okay. Okay, guys. So P stands for phospholipase C degradation. Phospholipase C degradation. Okay, means I am degrading the cell membranes. Okay. E for endotoxin. Endotoxin. This endotoxin will cause two things: fever, shock. Fever, shock. We have read this in the basics, isn't it? And it also has exotoxin A. Special exotoxin A. This exotoxin A will be doing something which I will be teaching you. No, elongation factor 2 inhibition. Elongation factor 2 inhibition. And P stands for your pigments. Okay. So mostly if they ask you, see, if they ask you which are the major, what can you see? Major pigment, that is the blue-green pigment. But it's not that you won't be seeing pyoverdin. Okay. Some books they may be writing pyoverdin. Pyoverdin. They may be writing pyocyanin. So the main characteristic question will be asked on pyocyanin, blue-green pigment, because it is the characteristic of this pus. Okay. By the way, what is this Erythema Gangrenosum? Where is that? Erythema Gangrenosum. What is it? Okay, I will be teaching you in a separately, but here, right, for your understanding, necrotic cutaneous lesion seen in immunocompromised patient. Immunocompromised patients. Okay, remember this much. Okay, now let me talk them a little bit in detail. Okay, pathogenesis, what it is causing. Okay, starting first with what it can do. This is I'm giving you some small boxes so that your life becomes easy. Okay, it's not that you have to remember everything about it. You have the significant, medically significant things. Remember that you are going to treat the things in the hospital. Okay, why it's becoming red? Yeah. Okay, PEEP. Now see, now you have to write like this. Now I will be telling you the pathogenesis and virulence factors. Their correlation. Okay. Virulence factors. Are you able to understand what I am doing? Yeah. So we read what diseases they are causing and what virulence factors. Now I will associate them. Write one lines in one straight line. This is for your last minute revision keys. Last minute revision keys. When you are preparing for the exam, before that just have a look at it. Just because you don't have time to revise everything. So you just have a look at this and you can write everything about this. Okay. Also you can solve as many objectives as you can. Okay. That's why I want to help you in this. Okay. Now see virulence factors. Now I am associating it with pathogenesis. Let us write in a simple way. Okay. Number one, it will cause colonization. How does it colonize? If it wants to colonize the Pseudomonas aeruginosa, what it does? It has that fimbri, it has pili, it has fimbri, it has pili. Meanwhile, the bird has came inside my room. Okay. Okay. Let them enjoy. So, colonization is done by pili, fimbri. I hope we understand everything about this. Okay. Second, it has two types of toxins. It has two types of toxins. If I classify those toxins, okay, if it has to injure your tissues, how it will injure? It will be having toxins. Okay, the toxins will be non-diffusible toxins, diffusible toxins. What? How to remember? Diffusible toxins, non-diffusible toxins. Are we clear? Let me write like this. Non-diffusible toxins. So toxins are non-diffusible toxins, diffusible toxins, diffusible toxins. Now these non-diffusible toxins um, are non-diffusible toxins are those exotoxins which I told you. Okay, they are exotoxins. But which exotoxin is not non-diffusible? Exotoxin A. So which are diffusible? Remember them. Sooty, sooty. Exotoxin S, exotoxin U, exotoxin T, exotoxin Y. These are non-diffusible exotoxins. Which are diffusible? Endotoxin A. Sorry, exotoxin A. Okay, have we written that in the above? Let me check. Yes. Okay, this is a diffusible. So exotoxin A. What else? Protease, phospholipase, PLC, phospholipase C. Hemolysis it also has. Okay, so remember this much. Pyocyanin also. Pyocyanin you can write as diffusible toxin. Okay, pyocyanin can also be. Now what is the mean? Why we have, what is more significant about this exotoxin A? See, exotoxin A is basically going to do the all those pathogenesis. Like, did you understand that diphtheria toxin? How in the diphtheria toxin that was inhibiting the elongation factor 2? How diphtheria toxin was inhibiting the elongation factor 2? Like that same, this exotoxin A of Pseudomonas will be inhibiting elongation factor 2. So this exotoxin A will inhibit the elongation factor 2. I hope you remember the function of elongation factor, isn't it? That was acting as a growth factor, isn't it? But if you are inhibiting, so what will happen? It will lead to the necrosis and everything at that place. Okay. So when what is the immunogenic thing in it? What things can induce inflammation in the host cell? It is because of lipid A. Lipid A is present on dash. Lipid A is present on dash. You will tell me. Lipid A is present on dash. Lipopolysaccharide. You forgot. Okay. Lipopolysaccharide, and it has flagella, so flagellin. So flagellin. So these two will be responsible for inflammatory response in the body of the patient. Inflammatory response. in the body of the patient, Okay, fine. Pigments, I hope I have written already. So pigments, I have written everything. Pigments, you have to write like this: fluorescein, pyruvicin, okay, pyomelanin, pyocyanin. But who is only producing this pigment? Majorly blue-green pigment, Pseudomonas aeruginosa. Rest other it can produce. But who is majorly producing? So I'm giving you both factors together. Okay. Did we say that it is having that mucoid polysaccharide capsule? Mucoid polysaccharide capsule. This will actually help in dash formation. If I have a mucoid strain of Pseudomonas, let me explain like this. Fifth, mucoid strain. If I have a mucoid strain of Pseudomonas, what they will do, they will be producing what? This slime layer. So remember, mucoid strain of Pseudomonas, they will be producing slime layer. They will be producing slime layer. This is also called what? Alginate layer. Alginate layer. Alginate layer. Okay. What it will cause? Biofilm formation. I have taught you in the basics of microbiology. Biofilm formation. Fine. Now, when it has to attach itself, what it does? This slime layer will help it in the adhesion, because the mucus which it is producing is basically purulent. The smell is no, it's that foul smelling. So it will help in the adhesion to purulent mucus. Purulent mucus. Okay. Now this purulent mucus, why I used a specific word of purulent mucus? Because in patients of cystic fibrosis is a genetic disease. Okay. In patients of cystic, this will be reading in your respiratory pathologies everywhere. So remember it today only. So they can what cause disease in cystic fibrosis patients. Okay. That's what is happening in the cystic fibrosis patient. So let me write like this. So they cause infection in patients with cystic fibrosis. Cystic fibrosis. Okay. Is there any doubt, guys? Okay. Let us write about this exotoxin A. Have I written something about exotoxin A? Yes. It is inhibiting the elongation factor 2. Okay. Let me write here only more what I remember from this exotoxin A. This exotoxin A is basically what? What if they ask you what is this similar to? You should first remember it is similar to, it is working like the diphtheria toxin. It is working like a diphtheria toxin. But if they ask you what it is actually, it is an adenosine. Please remember, it is an adenosine diphosphate. Adenosine diphosphate ADP ribosyl transferase. What is exotoxin A? You will tell me what is exotoxin A? It is adenosine diphosphate ribosyl transferase is equal to what? Diphtheria toxin. What a diphtheria toxin does, same mechanism is done by this Pseudomonas exotoxin A toxin. Exotoxin A toxin. What is the function? Inhibits the elongation factor 2. What will happen if you inhibit the elongation factor 2? You won't be allowing the protein synthesis. Protein synthesis of the cell is inhibited. Protein synthesis of the cell is inhibited. Which place, sir? If they ask you now which organ, you should directly say primarily liver. What? Primarily liver. Please make a star on this. Primarily liver. Okay. What will happen if liver is not having the proteins? What will happen? Liver necrosis. Liver necrosis. Liver necrosis. Damaged liver. Okay. Have we written anything about phospholipase C? Phospholipase C, have we written any detail? Let us write something about phospholipase C because we are correlating them. Phospholipase C, I write in short PLC. What it will do, it will be damaging the membranes. It will be damaging the membranes. Okay. What will happen if you damage the membrane? Necrosis. Okay. It also has elastin. Elastin. What is elastin? Sorry, not elastin, elastase. It also has elastase. What is the function of this elastin? It will digest the elastin. It will digest the elastin in the. I have taught you the extracellular matrix and everything, isn't it? We are talking about that. And it has IgA. What it will doing is whatever is outside this cell, it will start producing its enzymes and then will destroy them, finally leading to the damage of the cells. This you can remember. Okay. Any doubt till this moment? Now let us see what clinical manifestations we see. Okay, then treatment and then we finish. Okay, what clinical manifestations it can do. Okay, clinical manifestations, clinical features I can say, or clinical features. Number one, pneumonia. Which pneumonia? We are saying nosocomial, so it should be VAP. What is VAP? Ventilator associated pneumonia. Ventilator associated pneumonia. This you will be reading in detail in your respiratory medicine. Ventilator associated pneumonia. Second, chronic respiratory tract infections. Chronic respiratory tract infections, RTI, not Right to Information Act. Chronic respiratory tract infections. Which patients it will cause? Cystic fibrosis patients. Cystic fibrosis patients it will cause. Okay, it can cause bronchiectasis. Bronchiectasis. It can cause bronchiectasis, abnormal dilatation of the bronchus, or it can cause in some countries bronchiolitis. Bronchiolitis. Okay, let us take you to the air infections. Air infections, it can cause what? Otitis externa, I told you, isn't it? Otitis externa. So it can cause swimmer's air in children, and it can cause malignant otitis externa. Malignant otitis externa in which patients? In diabetic elderly. Diabetic elderly patient. Diabetic elderly patient. Okay. It can cause eye infections. What eye infections can it cause? Eye infections, corneal ulcer. Remember this, corneal ulcer. Okay. The people who are using lens, the people using artificial lens. Okay. It causes eye infections and can cause ophthalmitis. Ophthalmitis. Okay. Ophthalmitis. Okay. Fine. And it is also responsible for a fever in called as Shanghai fever. Okay, Shanghai fever. What is Shanghai fever, sir? Think that as if it is a typhoid fever. Same feature. Typhoid fever. Okay, same features like typhoid fever, but it's not that much high. It's mild variety. Okay. Now let us go to the skin. What it can cause in the skin? Okay, in the skin. In the skin, it can cause, if burn patient is there. I told you what it causes. Burn patient, it causes cellulitis, isn't it? Second, I wrote about Erythema gangrenosum. What is Erythema gangrenosum? I am revising your concepts. What is Erythema gangrenosum? Erythema gangrenosum. It's not erythema, it's ecthema. Ecthema. It's necrotic nodules. Necrotic nodules. It's a necrotic condition. Okay. In dash dash patients, in patients. So if they write an AIDS patient presented to you with this, will you say it's an immunocompromised? Yes, sir. A patient came to you with neutropenia. Is it an immunocompromised condition? Yes, sir. Immunocompromised condition. Okay. So it can cause, what is this infection called, by the way? The photo which I had, by the way, I remember. This is called toe web infection. So toe web infection is being caused by, this is toe web, isn't it? You have webs in between this. So this toe web infection is being caused by, okay, fine, toe web infection. Let me write this toe web infection. Where did we write? Yeah. So toe web infection is being caused by, so this will come in the skin, toe web infection. Okay. And it causes a green nail syndrome. What green nail syndrome? I don't have an image here. Green nail syndrome. What happens, if this is the nail bed and this is the nail, okay, let me make a nail for you. And what happens if you have any sort of a skin infection on this nail region or the nail pulp? We say it is called paronychia. Paronychia. Who was the most common cause of paronychia at that time? Do you remember any organism? I told you in the Staph aureus infection or Staph pyogenes. Which infection will cause this? Which infection causes paronychia? Who causes paronychia? Most common? I have taught you guys already. Staph aureus. Isn't it? Staph aureus and Staph pyogenes can also cause. Okay. So don't forget things, guys. Don't forget. Okay. Yeah. So green nail syndrome is a paronychia. Okay. What happens that a person is for a longer time, he has been put his hands in the water. Okay. The people who are working, have you seen the people who are working with, water occupational diseases? These are the occupational skin diseases, the people who have more work with the water and everything. So you'll be seeing a green nail syndrome in that, and the causative agent would be Pseudomonas. So it can cause many other infections, by the way. It can cause, osteomyelitis, I told you, sepsis, I told you, cellulitis, I told you. Okay. And cellulitis will be mostly characterized by blue-green pus. So you will be having that UTI also, meningitis will be there also if it's a post-operative patient. Okay. Now let us go to the lab diagnosis. Yeah. Okay. Now let us go to the lab diagnosis. Okay. Lab diagnosis. How will you diagnose this? Lab diagnosis? Anyone? How to diagnose, guys? They'll be asking you two things. One thing they will be asking you is, on which media can you see the pigment enhancement? That you will be seeing more that pigment enhancement. So the media is King's media. Remember that. If you put these negative rods in the King's media, you will be seeing enhancement of the color. One question is this. Second question they will ask you is, what is the best selective media for this? The best selective media is cetrimide agar. Best selective, not media. Best selective media. Best selective media is cetrimide. Cetrimide agar. Cetrimide agar. Let us write like this. This lab diagnosis you should write. It will be producing some sheen colonies. Sheen colonies. Okay. That is called iridescent, iridescent, iridescent sheen colonies will be produced by these. So these metallic sheen colonies can be appreciated on this. Okay. So if you take them on the blood agar also, what you will see? You will see hemolysis. Okay. Which hemolysis, by the way? Beta hemolysis. Beta hemolysis is dash type of hemolysis. Beta is dash. Beautiful answer. Beautiful answer. Beautiful answer. Okay. Very nice. Now, how to treat? How to treat? First, do culture and sensitivity. Antibiogram. Okay. Do a culture and sensitivity. Okay. Then what you will give? So friends, to treat this infection of penicillin, we will be giving some best anti-pseudomonal penicillins. Anti-pseudomonal penicillins. What are the anti-pseudomonal penicillins? Anti-pseudomonal penicillins are, to remember it easily, we will remember it as CityMap. CityMap. C for carpenicillin. Carpenicillin. T for ticarcillin. What? Ticarcillin. Ticarcillin. Guys, do we remember condom? My pharma friends, which I have taught in the past, do we remember condom? Saying, sir, what happened suddenly? Very nice. What is condom? What is condom? No, don't write the name. Just write what is no, no, no. Tell me what is condom. These are those penicillins which are resistant to penicillinase. These were those penicillins which were resistant to penicillinase. It was cloxacillin, oxacillin, naphthalin, dicloxacillin, methicillin, isn't it? But I'm not talking that condom. Okay, I'm talking about this CT-MAP. CT-MAP is anti-pseudomonal penicillins, the penicillins which will be effective against Pseudomonas. So you can use these penicillins for Pseudomonas. So ticarcillin, carbanicillin, meslocillin, meslocillin, A for azlocillin. I will be teaching the pharmacology students soon about this antimicrobials. Don't worry. In the pharmacology, we are going to start with that. Piperacillin, piperacillin, piperacillin. And we are using them not alone. We are using them with, please remember, we are using them with what? Beta lactams. We are using them with beta lactams. Okay, beta lactamase inhibitors. Let me write full. Fine. So we use these for Pseudomonas and we use these for with beta lactamase inhibitors plus aminoglycosides. Please have keep it mentioned there. Aminoglycosides that you will be learning in pharmacology. So we are using these two together. Okay, remember we give them together. Make like this. Okay, make another box with this plus. Okay, fine. Understood? This is a treatment. And if you have any drug, by the way, can you tell me which cephalosporins are effective against Pseudomonas? Beautiful answer. I have taught that already. It's 4C. It's 4C. What is 4C? Ceftazidime, cefperazone, cefepime. Let us write those. Let us write those. Okay, let us write the 4Cs. What are the 4Cs? Who can tell me? Okay, I write 3. Okay, I write 3, then 4th you tell me. Okay. Ceftazidime, ceftazidime, Cephalosporin, cephalosporin, cefepime. What is the next I should write? So we use fifth generation. We can use fifth generation also and fourth generation also. Okay, fourth generation also. Okay, so we have ceftaroline, ceftobiprole. Okay, ceftobiprole, you can remember ceftobiprole. This is the which generation? Fifth or fourth? Fifth or fourth, guys? People for pharmacology. Okay, thanks to God you remember this. So 55th ceftobiprole is mostly effective against, isn't it? MRSA and Pseudomonas. I hope you remember that. Okay, I taught you last time that if you talk about first generation, it is more effective against gram positive. Second generation, it is less effective against gram positive than the first, but can be having a nice gram negative coverage. Third generation is they are active against gram negative resistant organisms, isn't it? The gram negative resistance, we can use them. Fourth generation, we said they possess the activity against gram negative organisms, including Pseudomonas. And fifth generations are also effective against MRSA and Pseudomonas, isn't it? So this you should not forget. Okay, what is the drug of choice? Where can I use ceftazidime? By the way, I want to give a correlation with pharmacology. Where do we use ceftazidime? What is the drug of choice for? It is drug of choice for melioidosis. Melioidosis. What is melioidosis? It is a disease caused by Burkholderia pseudomyeli. Burkholderia. Let me write like this. Burkholderia pseudomyeli. This is how you can remember. If I pronounce it Malai, then you have to remember, you can understand well. Burkholderia pseudomyeli. Okay. Okay, guys, I hope you have enjoyed this session. I have tried to put everything at this point so that you can remember. Okay, so see you all in the next topic. Okay, so so if you want to remember that lab diagnosis, what will you be write in the lab diagnosis? What do you write in the lab diagnosis in the end? What you will want to write in the lab diagnosis? You can see the King's media as a pigment enhancement. You can use King's media for pigment enhancement, and you can also see that blood agar you will be seeing beta hemolytic colonies. Okay, so those things you can use, and it will produce a metallic sheen, iridescence we call that. Okay, produces those colonies. Okay, so see you all next time. Take care. Bye bye.